Though maternal health care has improved over the past 20 years, the pace has been slow and extra effort is required for Ghana to achieve the Sustainable Development Goal 3 in reducing maternal mortality.
When you look at the statistics of maternal health in sub-Saharan Africa, Ghana is one of the countries not doing too well. We've made a lot of improvements in our democracy and our good governance. We have a lot of improvements in most of our educational sectors and other sectors. But then when you look at the health sector and when we consider maternal health, it's untenable and it's sad to know that we still lose women just because they got pregnant or just because they wanted to give birth to life. And for us, this is unacceptable in the 21st century.
In urban Ghana, 82% of women deliver in health facilities. This, however, is not the case in rural Ghana, as only 42% deliver in approved health facilities.
When you look at the antenatal records throughout the country, midwives normally register a lot of pregnant women. But if it comes to delivery, compare those registrants to the number of deliveries, you realize that half of them deliver in the homes more than the hospitals.
Apart from the government of Ghana providing basic resources for the reduction of maternal deaths, some institutions have spearheaded projects to even accelerate the process further. One of such is SendGhana. In view of this, the Improving Maternal Health Services through Participatory Governance was launched.
The Improve project started in 2014. We had done our own political economy analysis in the health sector and realized that Ghana was not heading towards the realization of the MDG goals related to maternal health. Our analysis pointed to the fact that as a country we had not shown greater commitment in investing in interventions that will address maternal morbidity and mortality. And so we saw those gaps and we thought that Improve could provide some solutions and a good model to problems that confront us.
Christian Aid partnered with SendGhana to implement the Improve project in 30 districts across the 3 northern regions in Ghana. The project was funded by the European Union.
In terms of our relationship with Christian Aid and SendGhana, we launched a call in 2013 under the Non-State Actors and Local Authorities thematic program. Christian Aid applied with SendGhana as a co-applicant, where they work in the northern, the upper east and the upper west regions, basically trying to ensure that pregnant women survive maternal mortality.
A UN report on trends in maternal mortality rate from 1990 to 2015 indicated that though maternal health has seen significant progress over the years, the current level of 350 per 100,000 live births leaves much to be desired. The Improve project employs a unique approach of working through the governance structures and strengthen them to ensure better maternal deliveries.
We have been working with SendGhana for some time now, try to ensure that communities get what they need from government through the assemblies. And so SendGhana has been engaging our communities, trying to sensitize them on how they can demand their right from the assembly or government.
Dimabi, a community in the Talon district, used to access healthcare from Talon. Pregnant women had to cover a distance of about 10 kilometers before accessing antenatal services.
Tranang la zagaban tanda jin mitin shekodu sen gan mara kana kataman ma boite ti yongo tong ban puni yel mosr shanga dem biete zang chang te bihawo lebago polo bi zang chang te bihawo nyang la bo polo katra to hawo fable wo ba bi to hawo ba kama ti yongo yel shanga dem biene te ka konyor suma te ka banje te tong ban woni te ka shipte te tong ban woni to kabnong te vihla la han te pa puhnum zambashi te yelwa ye tolanka bichante zahna kabnong te viho bi bo boate ne ka dun chen tolama de vielte te bi de bo vielte te yaba de viela ama diri nyala yon baza de na vielte don sonan son to yin chante zahanka labna telande
de nan walago tolan nan walago ma banto nye zang moto zangocha bitiem pala tunje shamma karna mpo chongo mana zanma aku yana pansmata de motokia kabzana mpo bapaya.
There was the felt need expressed by the people of Dimari to have a chief's compound within the community. This was discussed with the health authorities of the Tolan District Assembly. And at the end of the day, a decision was taken. Stakeholders, including their representatives at the assembly, their chiefs, they all had inputs into the execution of the project.
To the partner on pan Novenzela Shiftima. The Papula was now you cone. One to Chandene. To Catamla Suhriate Tayel Gisi, Netum to Po Gisi. To Kavanyeda Shell Cana. Now no Namiko and Kara you.
The District Health Directorate is anxious to get the project commissioned to enable them send personnel there to provide service to the good people of Demabe.
The youth of Bandema also constructed a footbridge to facilitate easy access to the Wiaga Health Center by women.
The footbridge construction came about when FISTRAD did a community sensitization at Pandema, and this was under the Improve project. During the sensitization, the community members complained about their difficulty in accessing the St. Lucas clinic in Wiaga. As at the time we did the community there, it was almost getting to their annual festival that they have every year. So they said they were going to table the construction of the footbridge at that festival. And from that festival, they will see how they can raise money to be able to construct the footbridge.
During the rainy season, the ambulance cannot even get there. So they will call us and then we'll pick the ambulance, we'll go halfway and then we'll call them to bring the patient to the nearest point so that we will pick and come. With the bridge, I know for time to come it will help because the time the bridge wasn't there, it was also a problem. The rivers are two, this bridge and another one in front. So it was giving us a headache.
This construction was done solely by the community members.
When this bridge was not available, access to the hospital was tedious, especially days for antenatal service. But now, the bridge will make it easy.
The Chips Company in Asigri serves a population of about 10,241 with 13 staff.
We run OPD services, we do maternity services, and among others. So it's more or less like a health center. So staff strength had to increase. And the more the staffs were coming, getting accommodation for them was a challenge.
Through the sensitization workshop organized by SendGhana, the community saw the need to initiate a project that would provide accommodation for health officials.
It's just a 2-room apartment, which they have tried putting up. But for now, because of the financial constraints, if we would get partners who would hold our hands and help us complete this very structure, it will be of so much help to us. It will help us to serve the people better.
One of the remarkable achievements of SendGhana's advocacy efforts is igniting the communal spirit within the project communities. Chasi, a farming community within Wa East District, is one such example. After a sensitization meeting in Jairi, a nearby community, the opinion leaders of Chasi were inspired by how the people of Jairi contributed to put up a security post for health personnel through their own efforts.
I came and called our community together. Then we look at our challenges and prioritize those challenges. Then we came out with this mobile clinic. Then how do we build it? Then we decided, then let's tax each other.
So we started the contribution small. Then the community elders also added some monies. Then we have mother-to-mother support groups. They also supported us. And anytime we have community deba with SendGhana, then they have to give the community elders like cola or water for money for water. We just channel the money to continue with the project.
What I like most is the fact that We now have a health officer living with us in this community. This has offered 24-hour access, and we as women can discuss our health matters without being criticized. He comes to our homes and we feel very much comfortable. We want to thank the people who helped to save our lives.
The project set up district citizens monitoring committees who are made up of representatives of various interest groups in the district.
The DCMs are very important in terms of advocacy, education, and other activities, because they are known in the district as something like champions.
As a result of the sensitization, the project has successfully increased the understanding and skills of about 50 community champions in behavior change communication.
Amadi jahra amadi di mukse ay kyang so di ko katta mo khoy ay kyam ka ko mo to na katta bala amino sa nyen ta ko obi so mo shin nyen shin sa ki kyam nte so atimi sa ka am de so sahar lan dama ya ba ka ta pense a shin ta ma kyen de mala fane ngar yo modo dama yo ma ami yan di so ka ko ta ka ta di ko so na ko ba fura.
One key stakeholder of the improved project is the Ghana Health Service. The collaboration has resulted in the development of information, education, and communication materials, which is being used by the DCMCs and community champions in their sensitization efforts.
The Ghana Health Service is the umbrella body, which has about 10 divisions. The Family Health Division is one of them, and Health Promotion Department is one of the departments under Family Health Division. In the Health Promotion Department, we are into advocacy, social mobilization, we are into community participation, we are into reorienting health services to move away from the biomedical model into the social model. We develop materials, including leaflets, posters, booklets, and a whole lot of other materials. SendGhana approached us, and we built a collaboration in the course of which we reviewed materials relevant to their needs to enable them work on their improved project.
I want to take our opportunity to thank SendGhana for the wonderful job done in my district, West Gonja, Damango. We realize that IGF is a key thing in governance. In the formula in calculating common fund to a district, IGF has a role. The more IGF you generate in a district, the more common fund you can stand to benefit. SendGhana had a sensitization in the district, educate them as to the reasons why they need to pay their revenue, that is their taxes and other things in the district. And this particular assignment has boosted our IGF in the district. We've been able to put up a sick bay at Ndeure Senior High School. We are able to construct a chips compound at Hanger Line. We are able to supply to Vero Chips compound in the district 5 motorbikes to the chips compound. We have been able to provide 21 bicycles to the volunteers in various communities. We have 6 fridges that have been distributed in Vero Chips compound to make sure that the vaccines and medicines are kept well so that the women benefit in this regard. This is exactly the IGF has supported us to do.
Communication was found to be an effective tool in sensitizing citizens within the catchment areas. The project partnered the community radio stations in the districts to raise the awareness of citizens on maternal health issues.
So, Mr. John Macbeth, would like to find out how far we've come as a region when it comes to tackling issues of maternal health.
To enhance effective reporting by the DCMCs, SendGhana built their capacities in participatory filming to capture community-level experiences on maternal health.
Myself and my colleagues, we have brought a new face to our organization where we are able to take videos of activities, then we come, edit, and we are able to report that shows the actual picture.
SendGhana also employed capacity-building trainings under the project districts. A total of 60 DCMCs, 20 women and 40 men from the project districts were trained on the improved research tools. The trainings were meant to broaden the understanding of DCMCs and make them familiar with the participatory research instruments developed for data collection.
I was picked as a DCMC member from the community with the reason that when those questions are asked at the assembly and the health center, there may be improvement in the district.
The IMPROVE project was implemented by building the capacities of citizens to engage state actors to bring about the needed change in maternal health.
We are happy that this project is taking place in Dorumu. Mostly when our pregnant women are to deliver, when there are problems, mostly we are always referred to travel to Uchao or to go to Wa, because this facility is not there. Any little thing with a pregnant woman which can be solved here, but because of the fear, they will refer you to Wa. And sometimes it's not always easy moving from here to Uchao or Wa, because how to get a means from here to Uchao is not always easy.
The children ward in Uchao was awarded to a contractor, and this contractor, the district assembly organized a community deba and informed the community about the project, which the community was happy, and the land or the site for the contract was sown to the contractor, and the community agreed that was the area they want the project to be located. The work is going fine, and the community, we do visit the site, and we are happy that project is moving on well.
The achievement of SendGhana's IMPROVE project has been remarkable, and every effort should be made for its sustainability.
In terms of sustainability for this project, we have worked in building the capacity of the citizens groups. We've also liaised very well, I must say, with the local government structures, which are the district assemblies. They have been very collaborative, they have been very cooperative in this project, and we are very much assured that this project will not end even with the end of IMPROVE.
We are very pleased with what we have seen in the field so far. We've been to the field a number of times, and we've seen that they're working closely with the district assemblies, with citizens monitoring groups, to ensure that people are able to access maternal health care at the local level, and they've reported accurately in terms of our requirements, both narrative and financial.
I also like to thank SendGhana and Christian Aid very well. They have helped a lot. The male support these days, in fact, is very, very encouraging. I remember in July, we recorded over 300 deliveries, out of which over 100 males were involved. In October, we recorded 523 deliveries, out of which over 200 men were involved, some of whom, if it's cesarean section, accompanied their wives, stood by their wives, even during delivery and after. So we are encouraging more men to do same.
We as a country will have to make the necessary effort to make sure that no woman in Ghana is lost through the performance of her reproductive role.